What I love about what I do is it's a win-win-win. Like, we are exploring ways where the health plan wins, the docs win, and the patients win. That's what we do. That's what value-based care is doing.
I understand you have 3 kids from 3rd grade all the way up to high school.
Yes.
What type of activities do you do together?
You know, it's really evolved over the years. When they were, younger, it was definitely, a swimming pool or a movie. But now that my youngest has kind of turned the corner, if you will, to do more big kid stuff, we're able to do a lot more outdoor hiking kind of things. And I've also gotten them into football and soccer. So we have fun, watching it on TV or going to games and things like that. That's probably our favorite thing to do.
So, Dr. Eshelman, I have to ask you, how do you find calm in the midst of this huge storm that I'm hearing in a busy household?
Yeah, there's a lot of emotions in my house. I
Yeah.
have 3 daughters. The way I find it sounds a little counterintuitive. We got a puppy,
Okay.
which is not calming, but he's 10 months now, and going for walks with him has been a real way for me to kind of reconnect with the outdoors, the peaceful part of nature, just
Okay.
him and me. And so that's been really one way that I find some calm. But I love being in the mix. I mean,
Yeah.
it gets crazy, but it's.
And what's his name?
His name is Archer, so we are in a very Taylor Swift era
I see.
now. And so there's a song called The Archer,
I see.
hence that is his name.
Can we move on to talk a little bit about Inovalon? Walk us through the overall mission of the organization.
Yeah, I've been there for 15 years because of the mission. It's a very mission-driven company, so we are really all about trying to make healthcare more efficient, better for the patients, better for the providers, better for the health plans, and really doing that through technology. So, I was in practice, and I kind of experienced the clunkiness that is practicing in U.S. healthcare. And when I joined Inovalon, I've really just been excited about, the journey we're on to really play a part in how this is all going to get so much more efficient. Because as we know, healthcare has lagged behind other industries when it comes to technology.
Yeah.
Just put it mildly.
You mentioned a few moments ago that you were in practice, but it bears repeating, you are a physician.
I am.
You worked as a primary care physician
Yes.
on a Native American reservation, correct?
Yes.
Navajo Nation?
Not-
Tell us about that.
So I worked on a Navajo Indian reservation, which was in northeastern Arizona. Really a fascinating, I trained at Penn, so a big, academic institution, and then moved out to the Indian reservation, which was a tiny, we had 16 medical beds. We had a 4-bed ICU. Universal health care in the United States, which is, an unusual thing to experience. And still a lot of poor outcomes, right? Because, as we know, even though all the treatments were free, medications were free, healthcare is more than just that, right? But it was a really amazing experience to get to know that population, to build trust with that population. I missed it. It was a really great experience.
And how does that factor into your current role, the intersection between the two?
I feel like I've had a lot of different views on healthcare. Again, coming from a big academic center where I did my training, moving out to Indian Reservation. I also worked at a FQHC in Baltimore, worked at an academic at University of Maryland. So I've had a lot of different kind of views, had sort of the universal health care, had in Baltimore working in a clinic that was predominantly Medicaid or fee-for-service, so people with no insurance. So this is kind of before Obamacare. We had a sliding scale. And so managing patients as best you could with, Walmart $4 formulary, knowing that they didn't have any health insurance to get that cardiac stress test or different things that they needed. So going from universal health care to, no health care, and just seeing the different perspectives on it, I think has really helped inform what we're doing now, kind of seeing it from different angles. has been really helpful.
Speaking of healthcare from different angles, can we talk a little bit about analytics? And I would
Sure can.
love to talk about how it could transform healthcare, but just as importantly, how does it impact patients and also providers?
Yeah, I think analytics already are transforming healthcare. I think we're in an era of an acceleration of that for a lot of reasons, AI kind of being the foremost, but also, there's a lot of different data points that come together when you are taking care of a patient as a physician or as a health plan. There's information not coming just from the EHR, but coming from the pharmacy, coming from the interaction the pharmacist had, coming from if they had an in-home visit or chart review. There's lots of different information all coming together, and getting that sort of standardized and then applying AI where it makes sense to that is where we're really seeing, I think, the biggest surge in analytics. But, analytics, in the old way might be, has Kate had her mammogram or not? Yes, no. Now it's more, does she tend to do it? Do we need to worry about her? Is she going to do it on her own? What's her likelihood of kind of following through on that? And how do we combine that with everything else that's going on with Kate and really help the provider know what the next step to take? And I think that's really the transition that we need to go to value-based care. We've been in value-based care for a long time. I will never feel more passionate about anything in healthcare than I do about value-based care, partly because I'm a primary care physician. And as a primary care physician, you don't go into that because you want to see as many patients as you can in a day, right? But that's the metric that, when I was coming up was the metric, right? How many patients did you see today, Dr. Eshelman? Was it 30? Was it 40? And so getting that pivot where it's really how well I take care of my patients, and you can't do that without data. You have to have it. I have this dumb analogy I make all the time, but bear with me. It's a terrible analogy because I'm comparing doctors to car salesmen. However, if you are in a model where you're trying to see everyone that comes through the door and sell them a car, that's how you make your money. That's fee for service in a very crude way. And then you're asked to switch to, okay, you're not trying to sell a car to everyone that comes through the door. You want to know which person really needs a car, who to sell to, and then when you do, you don't get paid on a commission. You get paid on whether or not they get the oil changed, their tires rotated, how well they're taking care of their car. You need a lot of data to tell you how to navigate that. And that's
how far they've driven the car.
How far they've driven. Are they likely to come in for their regular service? Are they somebody that needs maybe somebody to go to them and go get their car and bring it in and talk? So, that's kind of what we're transitioning to. And the reality is you need a whole lot more technology to manage in that way. It's the right way. It's the way we all want to manage. It's less expensive and it's better care. And it's better for provider burnout, right? Because again, it's more about how well you're caring for your patients than how many patients did you see. But still a lot of physician friends that I know are still in a very fee-for-service. I mean, at the end of the day, their paycheck is still largely driven by volume. So we've got our work cut out for us.
Dr. Eshelman, you mentioned obviously analytics, and I want to talk about EPAS, which as I understand it, is the Electronic Patient Assessment Solution Suite.
It's my third child.
Your third child, okay.
It used to be my baby, and then I had a baby.
Okay. And is it in 5th grade, 6th grade? I mean, if you want to keep this analogy going.
Oh, my goodness. Yeah, it's about 6th grade now.
Okay.
Yeah. So the whole spirit of that was it's kind of like an EMR created for physicians, by physicians.
And just to pause, Dr. Eshelman, EMR stands for?
Electronic medical record. But what it really does is it gives the provider a whole lot more information than they can get because it's really the health plan's view on the patient. And this is something when I was in primary care I struggled with, right? The health plan would know if my diabetic patient had their eyes examined. I wouldn't because they paid the claim. I may not know because the ophthalmologist may never, send me a correspondence to let me know. And that's gotten better in time, but still there's so many different systems out there. Most of your eye doctors are not, on your same system. And
So it sounds like there's a lot of conversations happening, but everyone's talking past each other.
there's a lot of conversations happening. Everyone's talking past each other. And I think everyone, the genesis of EPAS was really to tell the provider everything that's going on with the patient, what medications they're filling, what's happened with them, but also what gaps in care, it's a term we all use. Have they had their colonoscopy? Do they might have a condition like diabetes that hasn't been treated and assessed, right? And so it's kind of bringing that all together and making sure that the provider is documenting everything properly. And I think we're getting closer. Again, it's taken a long time, but the amount of information sharing that's happening now is unprecedented.
Inovalon's one platform, what is that?
So Inovalon's one platform is really around trying to centralize everything that needs to happen with the patient in one platform. And again, that can't be the EMR, the electronic medical record, because there's so much that goes on with the patient outside of that EMR. So we've got a pharmacy platform where we're talking about the dispensing of the medications and the interaction that the pharmacist has had. We're looking at different interactions that the patient has had with the health plan.
I see.
Have they had someone come to their home? Are they eligible for some disease management program that they didn't know that they were eligible for? All of those things in one platform, because what happens right now is, on the health plan's perspective, a chart review happens for the patient, because sometimes charts need to be reviewed to see what happened. That information flows back into the health plan, but it doesn't all come into one centralized place where what happened, the results of that, combine that with results of the EHR, the claims, all of those things together in one platform that can really help service everything that's going on with a patient, because it's so much more than the doctor and the health plan. There's a lot of other entities. If you think about anyone in your family's journey, it's so much more than that, right? Yeah. There's the pharmacies, there's the home health, there's all these different other things that are happening to really help care for the patient.
Super helpful. Can you tell us a little bit more about the value-based contracting? What is the importance of that?
Oh, man.
You're laughing.
Get out my soapbox. No, value-based contracting is where we need to be. We need to be managing a patient based on how well we're caring for them. And I think what happens a lot when people hear the term in the industry, they think about utilization, right? Control costs. That's value-based contracting. Make sure you're not ordering too many laboratory tests or unnecessary MRIs or trying to keep the patient from, going to the ER if they don't need to go to the ER. Those are utilization metrics, right? That's what everybody focuses on. And that's very important. But it's three legs of a stool. It's utilization, it's quality, right? How well is Dr. Eshelman taking care of her patients, right? That matters, and that's why we have quality measurement to say that, because utilization doesn't tell the whole story. The other thing is the risk adjustment, the disease burden of the patient. How sick are Dr. Eshelman's patients? Because when you have those three things together, now you have value-based care. Because if my patients are really sick, of course their utilization is going to be higher, and their quality metrics might be a little bit lower. But that's okay because I'm managing a sicker population. And so those are the three variables that we need to make sure are all in play in these value-based contracts, and we need to make sure that the providers are getting the information that they need so they know how to succeed in those contracts. And that's really where it is.
Sure. Before the cameras were rolling, you and I were chatting about just how fast we are living, and in terms of all the technology that's out there, and that it's constantly changing, right?
Yes.
I bet you at the end of this podcast, technology probably would have changed at least twofold, right? Seriously, I'm not dramatizing.
It's amazing, the exponential curve.
Indeed,
right,
and here we are in the middle of this decade, right? I'm just curious to know from your perspective, how do you envision Inovalon's products evolving throughout this ever-changing dynamic that we're living in?
Yeah, I see our products as, again, having this platform that's kind of the one place where everybody can go to have sort of that single source of truth about what's going on with the patient, including the patient. And we're already using AI. We're going to be using AI where it makes sense, with human supervision, right? This is healthcare. So we're not ready to let the genie out of the bottle quite yet, right? But there's a lot of areas where just reading a chart and summarizing a chart and telling us what can happen and learning from that. There's a lot of great AI use cases, and we're exploring a lot of different ones. But where we are with AI right now is select use case. It can do this, right? It can do that, but it's not. It can do everything yet. And so we're really trying to build on, how can AI make things better for the patient and the provider and the health plan, with human supervision.
You have a lot of product, but also clinical experience, right? And obviously, clearly medical experience. How does all of that play into Inovalon's product lines? How do you show up in terms of helping to shape that narrative?
Yeah, I always am putting the provider's perspective in. I think, there's a lot of companies in this industry that don't do that. And I think it's really important. We're losing healthcare providers right now. So I think it's really important to have that provider perspective and say, that's great and all, but how would the provider actually use this information? How would they get to the information? And then will they find it helpful? And then also the patient as well. So, I've had a lot of experience with patients' journeys, both personally and professionally, and making sure that, whatever we're doing is going to be useful to the patient as well. And what I love about what I do is it's a win-win-win. Like, we are exploring ways where the health plan wins, the docs win, and the patients win. That's what we do. That's what value-based care is doing. And so it's fun and it's exciting because we're really trying to pioneer this and be a part of everything that's happening and really trying to advance things. There's a lot of work to be done, but there's so much progress being made that I think, in 5-10 years, my anticipation is, one, we're going to get a lid on healthcare costs, right? Because there's a lot of unnecessary stuff going on that's not even really helping the patient, right? And we're going to get to the point where the patient and the provider are in sync. And so I think we're really getting to a place where we're going to be a lot more synchronized, a lot more kind of going in the right direction. Right now, there's still a lot of chaos of getting all the data in the right place and actioning on it, but I am very optimistic about where it's headed.
You just took the words right out of my mouth. I'm smiling because you sound very optimistic about the future.
I am.
Which is exactly where we need to be. So thank you.
Sure.
And, in your own words, Dr. Eshelman, what is the next big thing in health from your perspective, keeping in this optimistic frame that you're in?
I think the next big thing in health is really around trying to re-foster the patient doctor relationship. Right now, it's been invaded by administrative burden and that computer in the room where they're like this, and we're not really having a good conversation. I think we're going to come back to that. Ironically, with technology, right?
Yeah.
Technology put us there.
Yeah.
But I think technology is going to bring it back around where when you see your doctor, you're actually going to have a solid 10, 15-minute meaningful conversation guided by technology, but the technology is going to be a little more in the background, kind of where it belongs in those interactions.
It sounds like it's almost full circle because before technology, it really was a meaningful conversation.
It was.
And then technology happened, and then it's just this, right?
Yeah.
And I think what I hear you say is we have all this data to have a very significant and meaty conversation, but let's talk eye to eye. Let's look eye to eye. Let's have this meaningful conversation about you and your health and your relationship with your own body, whatever that looks like for you.
Yes. Let's eliminate a lot of the stuff that's not going to be relevant, and let's use the technology to really focus on what are the 3 or 4 things that we want to talk about today where I'm going to leave the office feeling like, okay, I was heard, I know my plan, I'm on a good path, right? Back in the day, it was wonderful, except that information in my chart went nowhere, right? So it was very siloed. Now, with technology, we've brought all the information together, and we can use that to really get the most out of that visit again And I'm really excited. I think everybody in America is excited for that.
Well, thank you again, Dr. Eshelman,
Sure.
for your time. I look forward to continuing this conversation.
Me too.
3 months from now, 6 months from now, where we can have an even more meaningful conversation about the data. So thank you.
Sounds good. Thank you.